We better get it together. All right, celebrity cosmetic dermatologist Dr. Paul Jarrett Frank is joining us this morning with some non-invasive treatments that can help you get beach ready. Doctor, great to have you with us.
What's happening? Thanks for having me.
We really need your products. Whatever you got, we want. I'm noticing how good you look. I'm noticing you have no mask on also, nor does your patient. Everyone had vaccines?
Vaccinated. We are all vaccinated here at P. Frank MD. And as you know, summer bodies are made in the spring. And these are kind of the two hottest technologies that are getting people quick fixed and ready for their bathing suits.
So what do you have?
So here we have the EMTONE, which is a technology that's been around for a while. It helps with skin tightening, toning. It works great for cellulite, something you do once a week for 4 weeks. You could always do it before a big event or when you're going away. And then here we have the EMSCULPT Neo. Now this is the latest and greatest of the classic EMTONE. This is like a 2.0 upgrade. What it works is to build muscle tissue in ways that you can't do in the gym. And we all know we hit that wall with exercise at some point. And the newer version of the device called the EMSCULPT Neo also melts fat and also tightens skin. So it's really like the trifecta of body sculpting. Now, both of these devices are made by BTL Aesthetics. They're really the leader in non-invasive body sculpting technology. So when you use the two technologies together, you get a 1 + 1 = 5 type of reaction.
So interesting. It just not melts the body fat, but also pretends or teaches your body that you're doing like sit-ups and stuff like that?
Absolutely. So it uses electromagnetic technology, similar to an MRI. And what it does is it stimulates the nerve root of the muscle to cause hypercontraction. So it's like doing 20,000 sit-ups in a half-hour period. You can do the buttocks, you can do the arms, you can do the inner thighs, you can do the calves. There are different hand pieces. And the technology, which has been around for a few years now, has now 2.0. We're on to the next generation, and we're really doing wonderful things with totally non-invasive body sculpting.
Wow. Okay, I have to ask you, because you know I'm obsessed with Madonna. I know she's your business partner, and I know, well, I'm assuming she might be a patient since she's your business partner.
Yes,
but does she do any of these treatments?
Well, she is a patient. We do work together on MD&A skincare line. I can't really tone and tell, but definitely rock stars too need some help from medical technology. So let's just call it at that.
Oh, okay. We'll read between the lines.
Are there any risks to this?
Are there any risks? Well, you know, like with any medical device, most importantly, it's who's doing it. It's not just turning a machine on and off. I call the people who use these devices my registered nurses. They're kind of medical trainers. And what they do is they stand by you with the machines to increase the intensity as we go along, to really maximize the result that you get. But absolutely, just like when you work out, you could hurt yourself. You could pull muscles. You could strain the back, cause sciatica, cause burns. So this really needs to be done in a medical environment by a medical professional.
So how long are the treatments?
Well, the treatments take about 30 minutes each, and you generally do it about once a week for 4 weeks. People who love it, like with diet and exercise, there is a little bit of maintenance, and people will come in a few times a year, you know, before a vacation, before a big event, just to kind of tone and tighten.
So how long does it last?
Well, again, it's like how well you take care of yourself.
Right.
The results are permanent, right? If you work out for 6 months and eat really well, it's a lasting effect, but it really depends on how you live your life after that. We call this the pro-aging technique, and really how you live your life and take care of yourself afterwards is going to maximize the type of results you get from any of these treatments.
You know, this might be a good Mother's Day present, because those of us who have given birth, we have this thing below the belly button.
The pouch.
That, no matter what we do, Dr.
There are a lot of names for that. You know, we actually have the patient on the table here is a new mother. She gave birth about 4 months ago. And the EMSCULPT is really used amazingly. It closes that little gap that women get called a diastasis. So I usually tell patients they're doing a kind of mommy rejuvenation to start doing these treatments about 1 to 2 months after they give birth, with approval from their OBGYN. When they can go back to exercise, we could start building that muscle, flattening it, closing diastasis, and tightening it and getting rid of any cellulite. So this is great for moms.
So I'm just wondering, because you said you can do the arms, your bottom, the tummy. Can you come in and get a couple of those things done at one time, or should you just focus on one per visit?
Well, I have to say, there are people that book out these machines for the day. You know, there are definitely VIP patients who come in. We have multiple of these machines. You could hook up to 2 of the EMSCULPT Neos at one time. You could do the arms and the belly at one time, while someone else is doing an EMTONE cellulite treatment on the outer thigh. So we have multiple devices and locations at P. Frank MD. We just opened up in the West Village of New York, helping build back New York again. And yeah, it's a popular treatment. People spend time here.
So you're on the Upper East Side, you're in the West Village now, and how much does it cost?
The treatments, each treatment, a package, they could range anywhere between $3,000 and $5,000, depending on what you're doing. Obviously, people are packaging things up. It is investment of cost in the $1,000 range, but again, it's what you do with it, how you maintain it, and how you live your life. And it's really an icing on the cake to taking care of yourself.
I feel like you have all these new gadgets in there.
We're going to come try them out.
Yeah, and I would so much rather have that machine do 20,000 sit-ups than me.
Yeah.
Dr. Frank?
There's room in the studio. We're going to bring them all to the studio for, after shot.
We look forward to that.
And could you bring Madonna too? Because we really want to meet her.
I'm going to bring her. She couldn't make this one.
Yeah.
Thank you, Dr. Paul Jared Frank. So people can find you?
At pfrankmd.com or on social media at Dr. Paul Jared Frank.
Wonderful. Thank you.
See you later, everyone.
All right. We were like 6 degrees away from Madonna.
We were so close.
Anyway, our next guest was the latest singer to be on